Hello, you're welcome to this channel. I am Dr. Sandra. I am a medical doctor and a surgeon. I am all about creating awareness and sensitization among my patients and the general population, especially about the different surgical conditions. Today's video is about rodent ulcers. Rodent ulcers originate from the stratum basale part of the epidermis. By the way, just to recap, our skin is made of essentially 3 layers. We have what we call the epidermis from the top, we have the dermis, and then the hypodermis on the bottom. The epidermis, which is the uppermost layer of the skin, is made of essentially 5 layers. We have what we call stratum basale, the bottom part, where this ulcer originates from. Stratum spinosum just above that, stratum granulosum, stratum lucidum, and just on top we have what we call the stratum corneum. The inherent nature of the rodent ulcer is that it originates from a pre-existing basal cell carcinoma lesion. Basal cell carcinoma is actually a cancer of the cells of the stratum basale, the lower bottom part of the epidermis. And when we have an erosion of that lesion, the basal cell carcinoma lesion, we tend to end up with a rodent ulcer. Inherently, the rodent ulcer also has the other parts of the ulcer. It has a floor, it has an edge, the margin, and the base. The central part of the rodent ulcer, which also happens to be the floor, it usually has hyperpigmentation going on, or it has a scab covering it. And then the edge, which is just on the outskirts, the area on the outskirts of the central area, we tend to have raising and beading of that area, the edge, and we end up with what we call raised and beaded edge. It appears raised and beaded because there is massive proliferation, massive multiplication, massive growth of the cells of the stratum basale to form a clumping or a cluster of cells that surround the floor. So you end up with that picture of a floor that has a scab, or it is hyperpigmented, but the periphery of the ulcer is raised and beaded. That is what essentially happens. And the other thing that I want to really emphasize is the name, why it is called a rodent ulcer. It is called a rodent ulcer because it has the potential to behave like the rodents, the mice, the squirrels, the rats. You know, for them, they dig deep into the ground. It tends to also dig deep into the deeper tissues. It is a locally invasive ulcer. That is why it is called a rodent ulcer, because it also has the possibility, the potential of digging deep into the tissues. It doesn't go elsewhere, by the way. For it, it is locally invasive. What it does is, wherever it is, it just digs deep into, for example, the subcutaneous tissues. If it is on the skin, it digs deep into the adipose tissue, the fascia, the muscles, the bone, or the cartilage, depending on where it is actually located. What you should also know is it is always found, 90% of the time, it is found on the face. So when you have any ulcer on the skin of your face, that is a very bad sign. It could be that you're actually dealing with a rodent ulcer from the basal cell carcinoma. So it is very, very imperative that you come to the hospital on time if you notice any ulcers on the face of your body, on the skin of your face. If you also notice, you can also get them elsewhere, by the way, but it is rare elsewhere. You can get them on the neck, you can get them on the tibia, external genitalia. You can also get them on the mucocutaneous junctions, the mucous membrane of that junction between your mucous membrane, for example, of your lips and the skin surrounding. the vermilion junction. You can easily get it there, but it is rare. 90% of the time it is on the face. And like I've told you, we don't have any spread to the lymph nodes. And some books say that it is because the cells of the basal cell carcinoma of the stratum basale, they tend to block off the lymphatics. And it is kind of a protective mechanism, because if the lymphatics have been blocked off, you don't have to have a spread to the lymphatics. So that is what the books say, why we don't have any metastasis to the local regional lymph nodes. When it comes to the risk factors, patients that are lighter complected tend to also get this carcinoma, prolonged sun exposure, radiotherapy, patients who have had severe burns, patients that have some skin conditions like xeroderma pigmentosum, where there is hypersensitivity, that is photosensitivity, sensitivity to the radiations arising from the sun, patients that are having a low immunity, for example, they have leukemias, they have lymphomas, they are on anti-rejection drugs, for example, after maybe a transplant surgery. They also tend to have those lesions, the rodent ulcers. Patients that are chronic smokers, it is also a very bad risk factor. If you're smoking, please stop, because it can also predispose you to the skin cancers. The other thing that can predispose you is the HPV, human papilloma virus. You can easily also end up with a rodent ulcer. When it comes to the investigations, we always do what we call edge biopsy, just like the squamous cell carcinomas, we do edge biopsy. Edge biopsy is essentially taking off a sample, a piece of tissue from the edge of your ulcer, that area just that is surrounding the central part of your ulcer, and then we look out for any malignant changes within the cells of that tissue. The other thing that we can do is a CT scan to make sure that we don't have any deeper tissue involvement, especially the bone. Those are the two most important things that we do when it comes to investigations. Management is just excision. Remember, we don't have any local regional lymph node involvement, so we just do wide excision. And like I've told you in the previous video of the squamous cell carcinoma ulcer, we always have to palpate for the extent of induration. And where the induration ends, we excise the ulcer with the indurated tissue surrounding it 0.5 to 1 centimeters from the area where the induration ended. And after some time, we cover the defect with skin grafting, skin flaps, and the patient is okay most of the time. Especially if we didn't have any violation of the bones, of the cartilage, we just do that excision only. So you notice that you stand a higher chance when you come to the hospital on time, because we just have to do a minor surgery for you. So these are my take-home messages to you, my patients and the community, people in the general population. When it comes to the rodent ulcer, it is a locally invasive ulcer, meaning when you come on time, you don't have to undergo a major surgery or a transmogrifying or an anatomically altering surgery. You don't have to undergo that, especially if you come very early in the hospital. You can just have a very minor surgery. You don't even have to lose your bones. So please come to the hospital on time. And also the other thing that I want to tell you is that always check your skin, examine your skin to look out for any lesions on your skin. Always apply sunscreen to your body, especially if you're someone who is lighter complected, you are a white man, you're a white woman. Please make sure that you apply turn screen to your body. 2 hourly is okay, but it should be generously applied. And make sure that if you're in a swimming pool, you're sweating profusely that day, make sure that you do it even more often than 2 hours. I would also recommend that you wear protective clothing. Please wear protective clothing to cover your upper and lower limbs. Use a broad-brimmed hat. You can use an umbrella. Use sunglasses that protect you from ultraviolet A and B. The other thing that you can do is avoid tanning beds. You don't have to change your skin color. Please just avoid tanning beds, so that you don't predispose your skin to the emissions, the ultraviolet radiations from the tanning beds. Always examine your skin, like I've told you. Please examine your skin for any changes, any transformations within your skin, any new lesions, or any changes within any lesions on your body. Please look out for those. Yeah, so that is what I had for you. Thank you so much for listening to me. Thank you so much for sharing my videos. Please continue sharing my videos, continue liking, continue subscribing.